Hello viewers. Imagine waking up every day only to find a few strands on the pillow. It may soon turn into a shower drain clogged with lost dreams of luscious locks. A startling revelation from studies is that by the age of 50, approximately 50% of men and 25% of women face some form of significant hair loss. But what exactly are some of the reasons that cause these persistent hair falls? Often dismissed as a mere aesthetic issue, hair loss is actually a sentinel, an early warning system signaling imbalances ranging from nutritional deficiencies to chronic stress. In today's video, we are going to discuss 13 common yet subtle health issues that may cause hair to fall without you even noticing. Also, stick to the end, and we will tell you about the lifestyle changes that may help you achieve your dream of gorgeous hair. 1. Androgenetic alopecia, hereditary hair loss. Androgenetic alopecia, also known as male or female pattern baldness, is the most common type of hair loss and affects at least 80% of men and half of women by age 70, with the incidence increasing with age. In androgenetic alopecia, the presence of dihydrotestosterone, which is a hormone that plays a role in male traits and reproductive activity, shortens the growth phase and extends the resting phase. Eventually, the affected hair follicles stop producing new hair altogether. Additionally, dihydrotestosterone may cause the hair follicles to miniaturize. This miniaturization process makes the follicles shrink over time, producing progressively finer and shorter hairs. In some cases, the follicles become so small that they cannot produce hair, leading to baldness. It's important to note that the sensitivity of hair follicles to DHT is hereditary, which means the predisposition to develop androgenetic alopecia is passed down through genes. In a one-year study of 904 males with androgenetic alopecia, 62% of the patients exhibited a significant decrease in the affected region of the scalp when treated with 5% topical minoxidil twice daily, and about 84% of patients reported hair regrowth of varying degrees. 2. Telogen effluvium due to stress or shock. When Grandma told us that stress could make our hair fall, well, we should have listened to her. Under normal circumstances, about 85 to 90% of our hair follicles are in the anagen or growth phase, with the remaining 10–15% in the telogen or resting phase. Hair in the telogen phase naturally falls out after a few months, making room for new hair growth. In telogen effluvium, on the other hand, a major stressor like being very sick, having major surgery, being under a lot of mental stress, losing a lot of weight, giving birth, or taking certain medications causes more hairs to go into the telogen phase. After about 2 to 3 months following the stressful event, this leads to noticeable hair shedding. The most important aspect of the management of telogen effluvium is counseling the person about the natural history of the condition. According to several studies, hair shedding takes 3 to 6 months to cease, after which regrowth may be noted 3 to 6 months after the removal of the trigger, but cosmetically significant regrowth may take 12 to 18 months. 3. Alopecia areata, autoimmune hair loss. Alopecia areata is an autoimmune disorder that causes hair loss, often resulting in patchy bald spots on the scalp and, in some cases, other parts of the body. The exact mechanism of alopecia areata involves the immune system cells, particularly the white blood cells, targeting and disrupting the normal hair growth cycle. As a result, the growth phase gets shortened and prolongs the rest phase, causing the hair to stop growing and eventually fall out. The hair follicles remain alive and are capable of regrowing hair if the immune attack subsides. Keep in mind that alopecia areata may affect anyone, regardless of age and gender, but most cases occur before the age of 30. Individuals who have a family history of the condition, vitiligo or rheumatoid arthritis, are more likely to develop alopecia areata. According to the study, corticosteroids may be an effective treatment for alopecia areata. About 70% of participants saw hair regrowth after 3 months of using topical steroids. 4. Thyroid disorders, hyperthyroidism or hyperthyroidism. People mostly find out that they have thyroid disorders after noticing thinner hair or a change in weight. In hypothyroidism, the thyroid gland does not produce enough thyroid hormones, leading to a slowdown in the body's metabolic processes. This slowdown may extend to the hair growth cycle. As a result, more hairs enter the resting phase and eventually shed, leading to noticeable thinning and hair loss. According to research, patients with alopecia have 8% to 28% thyroid disease. Conversely, in hyperthyroidism, the thyroid gland produces an excess of thyroid hormones, which accelerates the body's metabolic processes. This may cause the hair growth cycle to speed up unnaturally, leading to hair thinning as the hair shafts become weaker and more prone to breaking. Additionally, when starting or changing thyroid medications, the body might take time to adjust to the new hormone levels, which may temporarily exacerbate hair loss. However, this is usually a transient phase, and as the thyroid disorder is managed and hormone levels stabilize, the hair loss often improves. 5. Iron deficiency anemia. In iron deficiency anemia, the reduced level of hemoglobin means less oxygen is transported to the body's cells, including hair follicles. Given their high rate of turnover, hair follicles are among the first organs to suffer from nutritional deficiencies. When they don't receive enough oxygen and essential nutrients, it disrupts the normal hair growth cycle. As a result, several months after the onset of iron deficiency, increased hair shedding and noticeable thinning may occur. In a study with 420 patients, researchers found out that female patients with hair loss had average serum ferritin levels of 49 micrograms per liter compared to 78 micrograms per liter in healthy women. People should focus on their diet and keep maintaining their daily iron intake, which is 8 milligrams. Although for premenopausal women, it is 18 milligrams, pregnant women require about 27 milligrams. 6. Protein malnutrition. Hair is primarily made up of a protein called keratin. In protein malnutrition, due to the lack of sufficient protein, the body reallocates its protein resources to maintain essential bodily functions, prioritizing hair growth. This results in more hair follicles entering the resting phase than usual, leading to an increase in hair shedding and noticeable thinning. In a 90-day double-blind study, among 60 women with thinning hair, 30 women taking an oral marine protein supplement twice daily experienced a significant increase in terminal hair count and reduced hair shedding. 7. Vitamin D deficiency. Vitamin D is known to help in the production of keratinocytes in the skin, which are cells that play a key role in hair follicle formation and hair growth. When there is a deficiency of vitamin D, there's a corresponding decrease in the regeneration and proliferation of these cells. This leads to less hair follicle formation and may impair hair growth. Individuals most at risk of hair loss due to vitamin D deficiency include those with limited sun exposure, as the body primarily synthesizes vitamin D through skin exposure to sunlight. In a study including 30 patients with androgenetic alopecia, the mean serum vitamin D level was 37 milligrams per milliliter, compared to healthy people having 44 milligrams per milliliter of vitamin D in their blood. Apart from that, in another study, 48 patients were given calcipotriol topically for 12 weeks. In the end, there was a positive response in around 69% of patients. 8. Polycystic ovary syndrome. Polycystic ovary syndrome, or PCOS, is a common endocrine disorder in women of reproductive age characterized by an excess of androgens or male hormones, which are normally present in women in small amounts. In a process similar to androgenetic alopecia, these androgens, particularly dihydrotestosterone, may shorten the hair growth phase and lengthen the resting phase, resulting in noticeable hair thinning and increased shedding. In a study, 472 women were diagnosed with female pattern hair loss, of whom 8% reported a known diagnosis of PCOS. An additional 15 women were referred to reproductive endocrine care from a hair loss clinic. Thus, managing hair loss in PCOS involves treating the underlying hormonal imbalance. This may include lifestyle changes like diet and exercise, medications to regulate the menstrual cycle and reduce androgen levels, and possibly hair growth treatments. 9. Lupus, systemic lupus erythematosus. Lupus is an autoimmune disease that causes hair loss due to the body's immune system mistakenly attacking its own cells and tissues, including those in the scalp and hair follicles. In lupus, the immune system creates antibodies that attack and destroy healthy tissue, leading to inflammation, which is a key factor in hair loss. In some cases, lupus may cause discoid lesions on the scalp, thick, scaly patches of skin that may scar. When these lesions heal, they may leave scars that destroy hair follicles and prevent the growth of new hair, leading to permanent hair loss in those areas. This is known as scarring alopecia. In other cases, lupus may cause more diffuse, non-scarring hair loss. This is similar to telogen effluvium and results in widespread thinning of the hair rather than bald patches. One study examined non-scarring hair loss in 4 women and found that the women lost between 55% and 100% of their hair in this condition. In a study of 122 systemic lupus erythematosus patients, researchers examined hair loss patterns and their relation to disease activity. The majority of patients, or 104 out of 122, experienced hair loss, with non-scarring diffuse hair loss accounting for about 65% of cases and non-scarring patch alopecia for 15%. If you wonder who might develop this condition, then let us tell you that people mostly get it through a family history of lupus. It predominantly affects women of childbearing age. However, lupus may also occur in men, children, and older adults. 10. Diabetes. Both type 1 and type 2 diabetes involve high blood sugar levels over prolonged periods, which may lead to damage in the small blood vessels throughout the body. This vascular damage impairs blood circulation, reducing the flow of oxygen and nutrients to various organs and tissues, including hair follicles. Hair follicles require a consistent supply of nutrients and oxygen to maintain normal growth cycles. Poor circulation may weaken hair follicles, slow down hair growth, and increase the rate of hair shedding. Effective management of diabetes is crucial to mitigating the hair loss associated with the condition. This includes maintaining optimal blood sugar levels through medication, diet, and lifestyle changes. Involving 5,389 African American women, the study found that the risk of severe hair loss was higher in women with type 2 diabetes. 11. Scalp psoriasis. In a healthy scalp, skin cells mature and are shed about once a month. However, in scalp psoriasis, this process is significantly accelerated, often occurring in just a few days. This rapid turnover leads to the buildup of skin cells on the scalp, forming thick, scaly patches. These patches may be itchy and uncomfortable, and the physical act of scratching or harshly removing the scales may physically damage the hair follicles, leading to hair breakage or loss. In addition to that, psoriasis is an autoimmune condition, meaning the body's immune system mistakenly attacks healthy tissues, causing inflammation. This inflammation around the hair follicles may interfere with normal hair growth, pushing more hairs into the resting phase, where they eventually fall out, a process similar to telogen effluvium. In a study of 47 scalp psoriasis patients, 66% presented with hair loss, with 36% experiencing it as their only symptom, indicating isolated scalp psoriasis. While scalp psoriasis may occur at any age, it most commonly appears between the ages of 15 and 35. 12. Seborrheic Dermatitis. Seborrheic dermatitis is a chronic skin condition that primarily affects areas of the skin with a high density of oil glands, including the scalp. The excess oil may create an environment conducive to the overgrowth of a yeast called Malassezia, which leads to irritation, redness, and scaling. The inflammation may cause hair follicles to weaken, leading to hair breakage and thinning. Keep in mind that it is more common in individuals with oily skin, those living with HIV or AIDS, Parkinson's disease, or other neurological conditions, and people under stress or recovering from a stressful event. In a study of 30 people with scalp seborrheic dermatitis, higher levels of superoxide dismutase catalase and malondialdehyde were found in skin scrapings from the scalp. This showed that there was a lot of oxidative stress. 13. Ringworm. Despite its name, ringworm is actually a group of fungi called dermatophytes that feed on the protein keratin, which is present in hair, skin, and nails. The infection typically starts as a small pimple that spreads, leaving scaly patches of temporary baldness. The fungus weakens the hair shafts, causing the hair to become brittle and break off either at the scalp surface or just above it. Individuals at greatest risk for hair loss due to ringworm are primarily children. A study looked at 134 kids with scalp and hair problems between the ages of 4 months and 14 years. The most common hair loss condition was tinea capitis, a fungal scalp infection that affected 47% of the kids with an average age of 4 years. It lasted an average of 2 weeks and showed up as either a single patch or several patches. Proper hygiene, avoiding sharing personal items and treating infected pets as animals may be carriers, are important preventive measures to keep your child safe from this type of hair loss. What are some lifestyle factors that may help you deal with these persistent hair falls? Dealing with persistent hair fall often involves addressing various lifestyle factors that may impact hair health. 1. Nutritious diet. A well-balanced diet rich in essential nutrients is crucial. Include protein-rich foods, iron, vitamins, especially A, B complex, and E omega-3 fatty acids and minerals like zinc and selenium, foods like eggs, fish, nuts, seeds, leafy greens, and lean meats are beneficial. 2. Stress management. Chronic stress may contribute to hair loss. Techniques like yoga, meditation, regular exercise, and adequate sleep may help manage stress levels. 3. Gentle hair care. Avoid harsh chemical treatments and excessive heat styling. Use mild shampoos and conditioners suited for your hair type. Minimize tight hairstyles that pull on the scalp. 4. Avoid smoking and limit alcohol consumption. Smoking restricts blood flow to the scalp, and excessive alcohol consumption may lead to dehydration and nutrient deficiencies. 5. Avoid overwashing your hair. Overwashing may strip your hair of its natural oils, leading to dryness and weakness. 6. Check medications. Some medications may contribute to hair loss. If you suspect this, consult with your healthcare provider. In exploring the myriad of health issues that may lead to hair loss, we've uncovered a complex tapestry of 13 causes, each distinct and significant in its own right. From genetic predisposition to lifestyle choices, each factor plays a unique role in the story of our hair health. Remember, while hair loss may be a distressing symptom, it's also a critical signpost pointing towards underlying health conditions that might require attention. Therefore, consulting with healthcare professionals is crucial. Now that we have discussed the many health issues that cause hair fall, let's dive into other topics of interest. Interested in knowing more about tips and tricks to shed pounds easily? Let's keep the conversation going with a couple more weight loss related videos, shall we? Watch Lose Weight with These 10 Foods. You may also try our video on 16 quick but strange weight loss tips you may use. Go ahead, click one. Or, better yet, watch both and learn more about weight loss and nutrition. Are you experiencing noticeable hair fall? Let us know in the comments below.